Hi everyone, my name is Megan Dibble and I'm extremely excited to show you this presentation I have made on the topic of vitamin C. So just as a little overview of what I will be presenting, I will be reviewing the basic information regarding vitamin C, what the recommended amounts are, the major functions of vitamin C, and the type of food sources that are rich in vitamin C, deficiency, so what happens if you do not get enough vitamin C in your diet, toxicity, meaning what happens to you if you get too much vitamin C in the diet, the nutrients' function and metabolism, also interesting things that I learned, and a fascinating highlight from literature that you won't want to miss. As a quick side note, I want to just let you know that I used abbreviated citations for both my text and the images, so you will find those at the bottom of each slide as well as a complete list following the presentation. All right, let's go ahead and jump right into it. So first off, vitamin C is a water-soluble vitamin. Water-soluble vitamins are essential organic substances needed in small amounts for normal function, growth, and maintenance of body tissues, and that's taken right out of our textbook. So only small amounts are stored in the body, and something that is really important to understand is that humans are unable to synthesize vitamin C, which means it has to be obtained through the diet. The recommended daily amounts are as follows. If you look at this chart at the bottom here, it says that for adults male, they need 90 milligrams per day of vitamin C. And for females, they need 75 milligrams per day. And if you're curious about the other recommended amounts, you can go ahead and take a look at this chart. It breaks down each of the amounts according to the years of the person. Also, another thing to notate is that smokers, they require an additional 35 milligrams per day than non-smokers. And the daily value on food and supplement labels is 60 mg. And the upper intake level for vitamin C for all adults is 2,000 milligrams per day. So as you can see up here, it says that absorption ranges from 70 to 90%. Interestingly, the rate of absorption declines substantially with doses exceeding 200 milligrams per day. So usually when you have an intake of vitamin C between 30 and 200 mg, the absorption is about 70 to 90%. You're getting the majority of that vitamin C. However, the more that you consume of vitamin C, the less your body is likely to absorb that. So I find that really interesting because we're told a lot in the media that we should be consuming over 1,000 milligrams of vitamin C, when really our body is not actually absorbing all of that. And we'll go into a little bit more detail later. So next we have the major functions of vitamin C. So first off, I want to talk about collagen synthesis. This is one of the main functions of vitamin C. And I have a nice little graphic here that was again taken from our textbook. So this shows that here you have a collagen precursor molecule. So what that means is that this is going to start making connective tissue. And when vitamin C is present, it can follow this natural path in which collagen is hydroxylated and all the elements are present in order to make this triple helix formed or the strong connective tissue. However, when vitamin C is not present, you get this weak connective tissue. So it is important to have strong connective tissue because the connective tissues are what make up strong tendons, ligaments, bones, blood vessels, eyes, and skin. So if you do not have strong connective tissue because vitamin C is not present, then it's going to make it easier for the tendons, ligaments to break or to tear, and then bones to break. Additionally, connective tissue is very important in wound healing. And if there's not sufficient vitamin C in your body, then you're going to have that weak connective tissue, which is going to affect your wounds. So if you get an injury or a wound, then it's not going to heal as fast as it would normally do with the ample amount of vitamin C. Next, vitamin C is electron donor in oxidation reducing reactions. It is also an antioxidant, meaning that it donates electrons to harmful free radicals. And harmful free radicals are unpaired electrons that are kind of floating around in your body that can damage the immune system. So vitamin C is really helpful in donating those electrons so that those free radicals are no longer harmful. It also aids in iron absorption in the intestine and is an immune booster. So white blood cells, as we know, are the ones that fight infection in the body. And those white blood cells are actually have the highest concentration of vitamin C. So if those white blood cells don't have adequate vitamin C, then they can't do their job. Next, we are going to discuss where you can get the most amount of vitamin C in the foods that you consume. So the majority of all fruits and vegetables contain some amount of vitamin C, but you're going to find that the richest sources come from citrus fruits such as lemons, oranges, and limes, peppers, especially red peppers, and green vegetables. The most common sources of vitamin C in our diet as North Americans include oranges and orange juice, grapefruit and grapefruit juice, tomato and tomato juice, tangerines, potatoes, and fortified fruit juices. So again, this chart comes from our textbook, and as you can see here, guava is actually the fruit that has the most vitamin C. Next up is kiwi, and the third is strawberries. And the vegetable that has the most vitamin C is the red pepper, and then Brussels sprouts. So what happens if you do not get enough vitamin C in your diet? Well, you may have heard of this disease before. It's called scurvy. And no, it's not just for sailors or for pirates. So scurvy can occur after about 20 to 40 days on a diet containing little or no vitamin C. So that means that your dosage has to be less than 10 milligrams per day of vitamin C. Symptoms of scurvy include fatigue and pinpoint hemorrhages around hair follicles. So you can see an example of this in the bottom images that I have here on the slide. So on this person's cheek, you can see these red spots. That's because the follicles are hemorrhaging. And also here over in the mouth, you can see that as well. Other symptoms include bleeding in gums and joints, impaired wound healing, bone pain, fractures, diarrhea, and depression. So typically scurvy is associated with poverty, but really anyone is at risk if he or she is not consuming enough vitamin C every day. It's especially common in babies who are fed boiled milk and not given a food source of vitamin C or a supplement. The book describes a story of a 5-year-old boy who was diagnosed with scurvy because all he ate was toaster pastries and frozen pizza and biscuits. So just want to make sure that you're getting a well-rounded diet that includes lots of fruits and vegetables so you can get an adequate amount of vitamin C in your diets. Next, we will discuss the toxicity of vitamin C. So you may be thinking now with water-soluble vitamins, usually the excess is excreted in the urine. So is it really possible to get toxicity from over-consuming vitamin C? The answer is yes, you can. If a person consumes like a megadose of vitamin C, such as like way more than 2,000 milligrams per day, then the person may experience these symptoms over here. The symptoms include diarrhea, nausea, vomiting, heartburn, abdominal cramps, headache, insomnia. It also increases your risk for kidney stones. Now we will discuss the function of vitamin C in the metabolism. So vitamin C is actually known as ascorbic acid, and in its oxidized form, it's known as dihydroascorbic acid. It becomes dihydroascorbic acid when it undergoes reversible reduction in oxidation by adding or losing 2 hydrogens. It also contributes to the synthesis of choline, which is required for nervous system function and aids in amino acid and lipid metabolism. Now, as I discussed earlier in the major functions of vitamin C, I just want to recall to your memory that It is also important to collagen synthesis, which builds strong connective tissue for tendons, ligaments, bones, blood vessels, and etc. It's also important for wound healing. So there are many important functions that vitamin C has in the metabolism and also in the body. Next, I would like to share with you what I found to be the most interesting while preparing this presentation. So vitamin C is actually the least stable vitamin, which means that it is easily lost in storage, processing, and cooking. So up to 40% of vitamin C can be lost while cooking. And that's because water-soluble vitamins are easily leached into the cooking water. Also very interesting is that potatoes, if they're stored up to more than 5 months, they lose 50% of their vitamin C content. Additionally, juices are the best way to get a good amount of vitamin C because the acidity in the juice reduces the destruction of the vitamin C. So some ways that you can retain vitamin C in cooking is through steaming, stir frying, microwaving. And I have this great image here that shows some different methods and has different tips on how you can preserve vitamin C in the foods that you are cooking and eating. So some of these suggestions include keeping the fruits and vegetables cool until eaten, preparing them right before serving, microwaving, steaming, or stir frying like I mentioned earlier, minimizing cooking time and reheating, not adding baking soda in order to enhance the green color, and to store canned foods in a cool, dry place, and to eat canned and frozen foods within 12 months so that that content of vitamin C is not completely lost. Alright, so as we near the end of my presentation, I would like to share with you the highlights from the literature that I was studying. So I'm sure that you have heard how vitamin C prevents colds or reduces the duration of a cold. Everyone's heard this. We're all told that we need to consume a lot of vitamin C when we have a cold. So is this a fact or a myth? Studies show that vitamin C is not effective at preventing the common cold in the general adult population. However, it is effective at preventing it when consumed regularly by extreme athletes. Some studies show that it does actually have a small marginal effectiveness in decreasing the cold duration by maybe 1 day. And the study that I was reading showed 8% in adults and 14% in children. But it does not decrease the severity of cold symptoms. However, when vitamin C is taken after the onset of symptoms, studies show that vitamin C did not affect the cold duration or symptom severity whatsoever. Alright, to conclude this presentation and wrap up everything that I have told you, I have a chart here that may help you to remember the things that I have told you. So if you follow the natural flow of this chart, it starts with the vitamin C. Vitamin C prevents many diseases such as scurvy. It makes collagen tissue. Remember what I was saying about connective tissue? It builds that strong connective tissue to keep your bones, tendons, and ligaments strong and healthy. It is also an antioxidant, which means that it neutralizes harmful free radicals that can harm and damage your immune system by giving off that electron. And remember that vitamin C is found in rich sources such as citrus fruits, red peppers, spinach, tomatoes, and of course you can always take that vitamin supplement if you need it. And finally, remember that your dose, if you are an adult male, is 90 mg per day, or if you are an adult female, it is 75 mg per day. And remember that smokers need an additional 35 mg per day. Well, I just want to thank you all for listening to my presentation. It has been a pleasure. And if you have any questions whatsoever, please let me know. Please send me a message or post the question. I'll be more than happy to help you. But thank you again for listening. And here is my list of all the references. You can see my text references and then all the references that I used for the images. Thank you guys.